Now, a new study by one of the nation's biggest health insurance companies provides a startling look at the toll that prescription opioids are taking on its policyholders. William Brangham has that.
The insurance giant Blue Cross Blue Shield analyzed medical records for 30 million of its customers, and it found some striking results. In 2015, roughly 20% of their customers, 1 in 5, filled at least one prescription for opioid painkillers. Almost half of those patients were prescribed high doses of those drugs, which are more likely to cause dependence. And indeed, between 2010 and 2016, the rate of abuse or addiction to those painkillers has shot up dramatically by almost 500%. This, while the rate of medically assisted treatment, considered the most successful way to curb those addictions, grew by just 65% in the same time frame. The report also detailed differences in opioid use between men and women and among different parts of the country. For more on this, I'm joined now by Dr. Trent Haywood. He's the Chief Medical Officer for the Blue Cross Blue Shield Association. Welcome to the NewsHour. This is a very, very interesting set of data that you have produced from your patients' records. We said 1 in 5 have had a prescription for these painkillers, obviously most of them for very legitimate pain suppression needs. But we've also discovered here that the rate of addiction has shot up. Why do you think that has been happening?
Well, one of the things, the reason why we wanted to focus on this particular issue is just what you just alluded to, the escalation in the opioid addiction from physicians prescribing these particular opioids. Starting in the 90s, we really went aggressive as physicians, making certain that we addressed pain. Unfortunately, it was found out later, as we're starting to see unfold now, we underestimated the risk related to that particular high doses of prescribing those particular opioids, and now we're suffering the consequences of that.
Some of this data that you guys have put together, it's not necessarily new news. Why hasn't the message seemingly gotten out to the medical community just how serious these drugs really are?
Well, one of the things that we know when it comes to medicine and the practice of medicine is that it really requires a substantial amount of time for it to change. We're heading to the Independence holiday, and so people are moving off to make certain that they enjoy times with their friends and family. But as this report highlights, all of us won't necessarily be independent this particular day, because whether it be your family, whether it be your neighbor's family, or whether it be someone down the block, we're all struggling with this issue of opioid addiction. Over 2 million Americans each year are suffering from this opioid addiction. And what's key about that particular aspect is that it's not one specific demographic.
The treatments, the best known treatments for these addictions, have barely kept up with the pace. Why do you think that is?
We're talking about someone moving from what would normally be an acute situation to a chronic condition. And so this opioid addiction is a chronic condition, and we need to treat it the same. We need to make certain these people are not only in treatment, but they have the necessary support for the chronic condition that they have.
If I'm a policyholder of Blue Cross Blue Shield and I recognize that I have a substance abuse problem and I come and I try to get treatment for that, will my policy cover that addiction treatment?
Yes, so one of the reasons why we're highlighting this is because you should absolutely make certain that you follow up at your local plan level to get that treatment. So this is something that is actually covered in most members' policies, and so you absolutely should be following up to get that treatment.
One of the things I was also struck by in your report is the gender differences. It seemed that when the genders are younger, when men and women are younger, men seem to be more vulnerable. But as we age, women seem to become more vulnerable to addiction. Do you have a sense of why that is?
One of the reasons why we think women are being impacted as we get into an older age group is the fact that they're appropriately following up with their physicians. If you think about it, the more that you're following up, the more likely that you're going to be prescribed an opioid. And so we're seeing women are actually at an accelerated pace the more that we get into the older age groups. And so that's the correlation that you're seeing why women would necessarily be higher, because they're more predisposed to actually getting that prescribed opioid.
At the very moment we're talking, the Senate is debating a health care bill that could eliminate hundreds of billions of dollars from Medicaid. Medicaid itself pays for much of addiction treatment around the country. Do you share the concern of many that if this bill were to become law, that those cuts to Medicaid could only worsen an already awful epidemic?
From every indication, this particular issue is not partisan at all. So whether you're on the right or on the left, what we've understood is, as it relates to the opioid epidemic, both sides of the aisle are eager to be able to address that particular concern. And so while there might be broader policy implications as it relates to healthcare reform on this particular topic, I think we all stand together as Americans.
All right, Dr. Trent Haywood, Chief Medical Officer of Blue Cross Blue Shield, thank you so much.
Thank you.